It's really important that children understand why they are doing the oral hygiene methods that they are doing. What do I recommend? I recommend introducing them to the Sugarbug Poo story. The Sugarbug Poo story is simply the story that explains the relationship between the bacteria in our mouths and having dental caries or problems with our teeth and gums. Sugar bugs are just another word for bacteria. Bacteria lives in everybody's mouth. This bacteria eats all the food that's left over on our teeth and then it does a poo, which is the plaque. So when you tell a child that they have plaque in their mouth, they may not be bothered. But when you tell them they have poo in their mouth, they are very, very bothered. So please introduce them to this story. I will also have some short videos coming up which introduce this story in an age appropriate manner for them. Many parents are struggling to brush their child's teeth at a very young age, and this is because they don't like having things done in their mouth. However, they also don't like their nappies being changed, but that doesn't stop us, does it? So, to put you in the right mindset, just remember that you would never leave your child in a dirty nappy, and equally, you should never leave them with plaque on their teeth. Leaving them with plaque in their teeth means that they can get dental caries, it means they can get gum disease, and they will be very uncomfortable and irritable. You need to start brushing your child's gums and teeth as soon as you can to enable them to understand how it feels to have their gums cleaned. You can use dental wipes or a small silicone brush, and also to massage the gums to make them feel really nice and healthy. As they grow older, use a fluoride toothpaste of 1000 parts per million on their baby teeth as soon as they come through. And remember, the 2-minute brushing rule doesn't really apply when you only have two teeth. So just making sure that you've got adequate plaque removal on those teeth will be sufficient. Remember to always keep the brushing routine really positive, really exciting for children, and make it into a fun activity. Your child can sense if you do not want to do it. They can sense the dread and they will play into it. So please make sure that you are very excited and very happy to be brushing their teeth, and they will be too. You can also tie it into other things such as activities with an iPad, with video on YouTube, anything to get them really motivated to brush. There's lots of toothbrushing songs available, and there's lots of apps as well to support you and your child with toothbrushing. As your children grow older, it's really important that you don't give over independence of brushing to your child. When your child reaches the age of 5 or 6 and they start to go to school, they may start to want to do things independently. However, your child is not able to brush their teeth on their own until they can tie their own shoelaces, because this is something that's tied into manual dexterity and it's not tied into age. So simply because your child has turned 5, 6, or 7 does not mean that they are able to brush their teeth. A better indicator is how their handwriting is, or if they can tie shoelaces really easily. Once they have the right manual dexterity to brush their teeth, that doesn't mean they can. It means that you need to guide them and teach them. And the way to do that is using disclosing tablets. Disclosing tablets can be your best friend as a parent or carer, because it means that you can actually see the plaque that is on the teeth and make sure that it is being removed effectively. The disclosing tablets or disclosing toothpastes that are available are very easy to use, and they mean that you can see the plaque on the teeth and make sure that you remove it effectively. With very young children, if you're using the toothpaste, that will be a very good indicator for you. But even the disclosing tablets can be dissolved and then painted on using a cotton bud over the teeth to see if there's any plaque remaining. Disclosing can be very useful for children who want to be independent with their brushing but are not ready yet, because you can ask them to brush on their own and then do some disclosing to show them just why they still need your help and intervention when it comes to brushing. When they have the manual dexterity to be able to brush, what you want to do is to help them to make their brushing really effective and efficient. They may not be brushing hard enough, they may not be brushing all the areas in their mouth, and the only way to know is by disclosing after they've brushed and showing them the areas which have been missed or the areas which have not been brushed properly, and they can go back and perfect their brushing. This is really the only way. When they become teenagers and start to push you to your limits and maybe don't brush when they say they have brushed, you can make sure that they're brushing by asking them to disclose, and then you can see for yourself whether or not they have been brushing or not. But really, disclosing is for the whole family. You can all do it. I do it, and I'm a dentist. It just makes sure that I'm removing every single dot of plaque in my mouth. So try to do it as a family activity. I would recommend at least once or twice a week. This will help to keep you all on track with your oral health. If you find at times when you're disclosing there's lots of areas which are being missed, please do it more frequently. Equally, if you're finding that no areas are being missed, you can do it less frequently, but still do it at least once a week. Because what I tend to find, even the people who are best at brushing tend to have moments when they're not brushing so well. And without that reminder when you're doing your disclosing, you don't get the motivation back to do your brushing better.